Differentiating delayed sleep-wake phase disorder from chronic insomnia in adolescents. Insomnia in adolescence is an independent entity that warrants attention as a public health concern in its own right. Teenagers between the ages of 13 to 18 years are recommended to get 8 to 10 hours of sleep on a regular basis for better health outcomes, and insufficient sleep increases the risk of accidents, injuries, hypertension, obesity, diabetes, depression, and self harming behaviors. Studies in adolescents in India confirm what has been published from around the world regarding sleep habits in adolescents, which is that older adolescents do not, in general, get enough sleep due to a multitude of intrinsic and environmental factors. According to ICSD-3-TR, when an adolescent presents with insomnia for more than 3 months, especially the sleep onset type of insomnia, it is particularly important to consider the possibility of delayed sleep wake phase disorder before establishing a diagnosis of chronic insomnia disorder. The reason being the onset of puberty is marked by a major and sudden shift in chronotype from early morning lark chronotype to late or night owl type of chronotype in adolescence, mediated by two distinct biological processes. First, the homeostatic drive to sleep accumulates slower, and melatonin secretion also shifts to a later time in this age group, causing a delay in circadian physiology, predisposing to a mismatch between preferred sleep times and social demands such as school. Early school start time has been recognized as a modifiable factor for insufficient sleep, due to which adolescents tend to accumulate a sleep debt which they attempt to recover during weekends, referred to as social jet lag. Due to the deleterious impact of early school start times on adolescents, sleep experts have been urging for later school start times, and California recently became the first state to move back school start times. While in India, a high percentage of adolescents attend additional coaching classes either before or after school hours to prepare for various high stakes exams. This commercialized coaching culture contributes to severe stress among students, which has led to the Government of India to unveil comprehensive guidelines for coaching centers at the beginning of this year. Under these guidelines, the coaching classes should neither be too early in the morning or too late in the evening. To summarize, a combination of various factors like psychosocial pressure, social networking, screen time, early school start time, societal pressures, all combine to create a perfect storm of short and ill timed sleep with unwanted and associated consequences in youngsters. And delayed sleep wake phase disorder, or DSWPD, is diagnosed when the mismatch between sleep patterns and social demands causes functional impairment. It most commonly presents as difficulty in initiating sleep. Accompanying complaints may be daytime irritability, poor school performance, and excessive daytime sleepiness. According to the ICSD-3-TR, the symptoms or complaints should be present at least for 3 months. The main differentiating feature between DSWPD and chronic insomnia is that when patients are allowed to choose their ad libitum schedule, they exhibit improved sleep quality and duration for age. This can be elicited in history by asking questions like at what time do they go to bed and the reason for the time. Is it because they're sleepy or they need to wake up early for school? And if they were allowed to sleep in or choose their schedules, till what time would they sleep, to differentiate this from chronic insomnia disorder? History should also include questions about obstructive sleep apnea and restless leg syndrome to rule them out. As a correct diagnosis is important for appropriate management, it's also important to screen for ADHD, autism spectrum disorder, and neurodevelopmental disorders, and comorbid psychiatric and medical conditions. It's also important to rule out narcolepsy in this age group, given the larger peak of onset around 15 years, given that narcolepsy is frequently undiagnosed or underdiagnosed. ICSD-3-TR requires sleep diaries for diagnosis and, whenever possible, actigraphy. They should be preferably for 14 days, at least for a period of 7 days, and should document sleep both on school days versus weekend, school time, vacation time, desired sleep time, and actual sleep time. Improved sleep quality during weekends and vacations is also a differentiating factor between DSWPD and insomnia, chronic insomnia disorder. Sleep logs and actigraphy demonstrate stable delay in the period relative to clock time. Chronotype questionnaires show night owl preference. Circadian biomarkers are also helpful to establish the diagnosis. The two main circadian biomarkers being melatonin levels, which usually the DILMO, the dim light melatonin onset, which occurs approximately 2 to 3 hours before sleep onset, and core body temperature min, which usually occurs 2 hours before habitual wake time. The treatment involves an advancing endogenous circadian rhythm to the desired sleep and wake schedule, using strategically timed melatonin, post awakening light therapy, and behavioral treatments as per the clinical guidelines suggested by the American Academy of Sleep Medicine. Exposure to morning light after core body temperature min will advance the circadian rhythm, and administration of exogenous melatonin 3 to 5 hours before DILMO in the correct minimal effective dose are the mainstays of treatment. Caution should be exercised against complacent use of melatonin in adolescents given the paucity of literature about the adverse effects. Sleep hygiene should be discussed before starting melatonin supplementation. Especially the effect of light on melatonin is a fundamental consideration in sleep hygiene. On the other hand, chronic insomnia disorder can also present as sleep initiation insomnia, but the etiology is quite different from DSWPD. According to 3P model, Spielman's 3P model, predisposing factors, precipitating factors, and perpetuating on or maladaptive behaviors all play a role in initiating and maintaining insomnia. Psychophysiological insomnia being a common subtype of insomnia in adolescents. Due to hyperarousal, which is characterized by worry, rumination, and intrusive thoughts, they have difficulty in falling asleep and also having a restorative night sleep. Dysfunctional beliefs are also common. Sleep diaries document extensive night to night variability. Cognitive behavioral therapy for insomnia is an evidence based approach which has shown to improve sleep quality in adolescents with insomnia symptoms. It has a multiple it's a multiple component approach consisting of stimulus control, arousal reduction, sleep restriction, cognitive therapy, and improving sleep hygiene practices. It's important to adapt these components in adolescents. For example, limiting screen time, then asking them to totally cut down screen time and engaging parents to make this treatment more acceptable and feasible. To summarize, DSWPD is due to circadian misalignment. A teenager who is happier being a night owl is forced to be a morning lark. Whereas in chronic insomnia disorder, irrespective of the sleep opportunity or schedule, difficulty in initiating sleep is due to rumination, intrusive thoughts, and worries. Sleep diaries can also help in differentiating these two disorders and asking questions like intrusive thoughts and anxiety before falling asleep is vital to distinguish these two disorders. Screening for sleep disorders and sleep health awareness programs and educational institutions about benefits of sleep and digital wellness strategies like allocating at least 1 hour of outdoor physical activities, pursuing curative hobbies are all important in preventing DSWPD and chronic insomnia. Prioritizing sleep health also means prioritizing mental health. Educational institutions should have a holistic environment with the involvement of counselors and psychologists to help stress management, helping adolescents choose a meaningful life path in alignment with their authentic self, and creating an inherent sense of self worth beyond academic scores and career aspirations, along with having an effective self care routine, all help in navigating this crucial period of life and laying a foundation for happier, healthier adulthood. Thank you.